procedures, section 2, adult health 1. I'm going to do IV minibag. I'm going to verify this is the right patient, right route, right dose, right drug. I'm going to use Flagyl is going to be my drug of choice, which is an anti-infective, anti-protozoal, and anti-ulcer agent. We've already verified the labs, which are in therapeutic ranges, BUN, creatinine, and white blood cells, and a CBC. The actions, it disrupts DNA and protein synthesis in susceptible organisms. The purpose is a treatment of anaerobic infections. The recommended dose is 15 milligrams per kilogram initially, then 7.5 milligrams per kilogram every 6 to 8 hours. Some side effects could be dizziness, seizures, dry mouth, optical neuropathy, headache, and phlebitis. Some contraindications are hypersensitivity and severe hepatic impairment. We already did our calculations, so we're going to add 2 milliliters of the Flagyl to our 100 milliliter bag, and we're going to do it at 17 drops per minute. So once I'm going to draw up in my syringe 2 milliliters of the Flagyl, get my alcohol pad, wipe it off, dispose of it. I'm going to pull back 2 milliliters. Okay. Once I do that, I'm going to add 2 milliliters to my bag. Not sure if the bag was used before or not, so I'm going to wipe it off. Dispose. Insert my 2 milliliters. Dispose of my syringe in my shops container. Mix my medication up. Once I do that, I'm going to draw up my 6 milliliters of normal saline in a 10 milliliter syringe, and I have that here. I'm going to assess the site, which has no inflammation, no redness, no pain. I'm going to label my bag with the client's name, drug, dose, the time of administration, and my initials. I'm going to take my cap off. Apply my tubing, and I'll also label my tubing with time, date, and my initials. Hang my bag. I'm going to unclamp. Make sure I don't have any air bubbles inside of my tubing. And it's coming slowly. Okay, the water is coming, so there's no air bubbles, no occlusions. Clamp my tubing back off. Put it up here. So once I do that, my tubing is labeled, my bag is labeled. I explain the procedure to the client. No pain, no inflammation, no conditions with the IV site. I'll wash my hands, put on my gloves. Before I flush, I would begin the ASASH procedure, which is the aspirate saline, administer saline, heparin. Heparin is for the PICC line or the central line per order. So once I do that, my gloves are on. Just a minute while I get some gloves. Okay, so I'll apply my gloves. I'll clean off the port. I'm gonna with before I unclamp it, I'm gonna apply my needleless syringe to flush it, 3 milliliters at a stop and go flow. I'm gonna unclamp it. I'm gonna aspirate for any flashback, which I do get. Then at a stop and go rate, flush for 3 milliliters. Okay, and on the last milliliter, I'm going to flush and clamp off simultaneously. Okay. So once I do that, I'll apply my tubing. Okay. So I apply my tubing. Then I'm going to set it at my 17 drops per minute. I'm going to unclamp the tubing. Then I'll count for 1 minute the 17 drops, which it goes. So I'll remove my gloves, leave the room, come back in an hour. When I come back, my bag would be empty. I will assess the site again, no redness, no infiltration, no inflammation. Then I would clamp off. Well, it's already empty, I don't have to clamp it off, but I will disconnect the tubing, put an alligator clamp on the end, hang my tubing. My last 3 milliliters of normal saline, I'm going to flush again at a stop and go rate. Okay, dispose of that. I'm going to clamp this back off, leave that there, and I will explain to the client that, you know, no tugging on the IV. If anything was to go wrong, to let me know. Then once I leave, I'm going to document on my MARM, record the time, the drug, the route. I'm going to record the dosage, the condition of the IV site, and the volume of fluid that was delivered in the med, and any inputs and outputs. And that's all for my minibag.